Hi, I'm Dr. Chin Long Lin, the CEO of FUTEX2021 Medical Foundation from Hualien. I'm here to introduce you to our program. It's called Population-Wide, All-Inclusive, Comprehensive, Innovative, Functionally Integrated Care Model. That is, we're trying to build a hospital without walls of 35,000 beds. We are in a large geographic area in eastern Taiwan. It spans over 300 kilometers with a population of just over 500,000. However, we have outpatient visits of 10,000 annually. So this is what we are faced with. We have an aging population. The disease pattern becomes more and more complicated, and the demand for medical care increased substantially. We have to shift the institution-based healthcare to community-based or home-based healthcare because we just doesn't have enough medical personnel to take care of such a large population. So we have to balance the medical resources. We are trying to strengthen our rural medical services and at the same time promote the integration of our medical system. We try to help the disadvantaged and the rural people in order to improve our life expectancy. So we think big, we start small, but we have to move fast. We start from eastern Taiwan, the remote area in Taiwan, as you know. But we're trying to replicate the same type of services to the whole Taiwan, slowly, year by year. So we use a small township as a pilot project in the eastern part of Hualien. It's called Xiang. But now we have covered 8 townships in Hualien and Taidong in the eastern part of Taiwan, as you know. We use the basic units and we use medical records and their preventive health care, chronic diseases data, long-term care facilities, and homes. Plus, we use a new available medical record system, FHIRI, and also geographic information system to help. Plus, the social media, it's called Line. We use there as our communication. So we established this network of governmental officials, the care providers, and also the internet and communication companies together. We enlist the help of universities, the academics, plus the NGOs, the Tzu volunteers, the charity foundation. So together we provide this medical care model. We use the cloud medical records as a backbone. We put everything onto the cloud. We management, financial data, and the care, plus the medical information, including the records and everything onto the medical cloud system. So this way, all the providers will have access to it through the internet. In that, we have the hospital information system and also the FHIRI system, the medical records, and the family health records, personal medical records, all in one place, accessible right away to real time to all the providers when they need it. So this information integration is a very important part of our program, what we call family health records. We use a household, the parents, kids, everything in the family together as one unit. So the public care nurse or the physician, primary care physician, will have access to the whole family's medical records in order to provide the preventive care, treatment, or whatever is necessary. So this is a very important part of our program, because in Taiwan, the medical records used to be dispersed among different institutions in different places. We put them all together in one household record. So we use a common, a new file system. It's called Health Language 7 file as a basis. So it is can be accessed and recorded by the different providers, easy access to it. So also we use the modern technology such as wearables, mobile devices, iPhones, iPads, or what have you, wireless, then to finish our program. We even used for 5th generation telecommunication because it has higher speed, wider bandwidth. So this way we can transmit a big data in a very short time. So this way we can use this communication to provide videos for teaching health education for patients and the caretakers alike, and also as a communication between the nurses and the physicians, between the nurses and the families and the caretakers as well. So this is the wearable we use. And also the gatekeeper concept. We trained a bunch of gatekeepers. They go to the houses and teach these patients and the family members how to use the modern technology, how to record the health data, and how to transmit onto the cloud. So this is a very important part of our program. So this way, everybody will benefit from this program. So this is what we have done in the rural areas using the telecommunication and apply all different applications, as you can see, including the psychosocial counseling, including the medical care, and so forth. So this way, we use the wearables devices to help. So we have built a health data that is pretty big, since use this electronic medical record gathering system. We have gathered the big data. This will be used for further management and research purposes. Also, we have the social network, the communications between the healthcare workers, social workers, and the long-term care facility managers, all together, the health professionals as well. So we provide health promotion services in addition to regular medical care. In addition, we are trying to how to improve our system so that we will prolong the lifespan of our people. So we are now in the current one and into the current two, phase 2. That is, we provide the services in Eastern Taiwan. But next year, we'll go into western part of Taiwan. And hopefully, in a couple of years, we'll cover the entire Taiwan. So this is our program. It's my pleasure to share with you. Thank you.